evening. I'm Casey Palumbo, and the purpose of my speech is to persuade people to understand the dangers of the spread of infection in a hospital setting and take steps to improve cleanliness. There is a very high risk of infection in hospitals, and I believe there are many steps that staff and visitors can take to improve and decrease the spread of infection. Many hospitals work very hard to reduce avoidable infections and to provide a clean and safe environment for patients, their relatives, and staff. Although the hospitals work hard to prevent the spread of infection, many staff members, patients, and visitors do not follow the correct procedures to make sure the hospitals stay clean. I believe that more time, money, and efforts should be put into buying better supplies and educating staff, visitors, and patients on how to follow the steps to prevent infection. There are many ways that hospitals can manage infection prevention and control, such as hand washing, cleaning, training staff more effectively, and using proper antibiotic medications. Hand washing is essential in preventing the spread of infection, but the evidence for current hand washing policy is very weak. Some healthcare staff may consider that hand washing takes up precious time, and they may fail to wash their hands because they are too busy, which is a horrible excuse. Good hand washing technique can save time and remove microorganisms more effectively. Proper hand washing technique includes washing the tips of the fingers, the palms, in between the fingers, the fingernails, and the whole front and back of the hands. Hand washing is one of the most essential tasks to correctly complete when preventing the spread of infection. Hand washing is a great way to prevent the spread of infection, but there is a lot more cleaning to be done, not just on your hands. Making sure the patients are in a clean environment is another factor in keeping the spread of infection to a minimum. Microorganisms can live on any part of hospitals, including beds, sinks, tray tables, toilets, doorknobs, and telephones. When something has been used, it is the responsibility of the hospital to clean it. No excuses. Also, having a clean environment will help the patient feel more safe and at home. You do not want to have a patient walking out of your hospital saying they had a dirty room and a horrible experience. That is just unacceptable. It takes a lot for a hospital to live up to its clean expectancies, and it is absolutely necessary for well-trained staff to understand and fulfill their duties fully and correctly. Hiring and training staff in a hospital and making sure they understand their procedures is critical in keeping the environment infection-free. It is very important when hiring and training hospital cleaning staff to make sure they understand the correct cleaning procedures. Even though this may be costly to the hospital, it is worth it in the long run. One of the best ways to accomplish effective hospital housekeeping is to determine which areas are at high risks for transmittable infections and to clean all areas by using chemicals correctly. Making sure the housekeeping staff is well trained is a necessity. You do not want someone in your hospital to get an infection because you chose not to thoroughly train your cleaning staff. That is unacceptable. If a patient finds that your dirty hospital is the reason for their infection, there is a very good chance that they will sue you. Spending the money to train your staff efficiently could avoid the patient's infection and you being sued. Keeping a hospital environment clean is very important, as well as giving the patient the proper medication to avoid infection. Antibiotics are often given to the patient to prevent infection, especially before and after surgery. Antibiotics are given to the patient before surgery to prevent infection. Taking these antibiotics for more than 24 hours is not necessary and could result in wasted medication and money in your hospital. More importantly, continuing the medication longer than necessary could pose for even more problems, such as serious stomach aches and severe diarrhea. Hospitals should also make sure patients receive the correct antibiotics after surgery to prevent wound infections, and providing the correct types of antibiotics for certain surgeries is also essential. Giving antibiotics to patients before and after surgeries is extremely important and could help to prevent vicious infections when the patient is under the knife or in recovery. Antibiotics, cleaning, well-trained staff, and hand washing are all essential to preventing the spread of infection in hospitals. Although many policies and procedures to avoid the spread of infection in clinical environments are very weak and misunderstood, these steps should persuade you all to think twice before you decide to enter a hospital environment that is dirty. I hope that you all have a similar opinion to mine when it comes to improving ways to prevent the spread of infection in clinical environments.